Good morning, and thank you for joining us here today. We are here this morning to announce the results of truly historic nationwide law enforcement operations led by the Criminal Division's Healthcare Fraud Strike Force Program, which is part of the Criminal Division's Fraud Section. From April of this year till today, the Criminal Division, along with our colleagues in U.S. Attorneys' offices around the country, and our law enforcement partners, including the Federal Bureau of Investigation, the Department of Health and Human Services Office of the Inspector General, and the Drug Enforcement Administration, have charged more than 300 individuals with healthcare fraud schemes involving more than $6 billion in alleged healthcare fraud and millions of prescription opioid doses. Measured solely by the amount of loss these defendants are alleged to have attempted to cause the federal government and other third-party payers, today's announcement marks the largest amount of fraud ever charged by the Department of Justice in a single national takedown operation. Our efforts represent a continuation of the department's ongoing work to combat the devastating effects of healthcare fraud and opioid abuse around the country. And while this effort has been led by our Criminal Division Fraud Section's Healthcare Fraud Unit, it truly reflects a nationwide effort, with the department bringing cases in more than 50 separate federal districts and participation by over 40 U.S. attorneys' offices around the country. These cases involve charges against a wide variety of people, with charges brought against more than 100 licensed medical professionals, including more than 50 doctors, and more than 20 healthcare executives. These cases also cover a wide variety of alleged healthcare fraud and illegal prescription opioid schemes. Some of these schemes, unfortunately, are all too familiar to us from our work over the last several years. These include schemes with defendants who allegedly billed for millions of dollars of products or services that they simply never delivered, or where defendants allegedly prescribed and billed for medically unnecessary treatments and medication, including, as I mentioned before, powerfully addictive and potentially destructive opioids. These cases also represent a number of new schemes that we are charging for the first time. These schemes reflect what we believe to be harmful trends that appear to be emerging in healthcare fraud. We are tracking these new trends and responding aggressively, as today's announcement and operations demonstrate. These cases, of course, are only the latest in the department's years-long effort to safeguard the nation's healthcare programs from fraud and abuse. For example, since 2017 alone, the Criminal Division's Fraud Section has charged more than 1,000 individuals with more than $10 billion in healthcare fraud, including fraud related to the abuse of prescription opioids. Preventing and imposing accountability for healthcare fraud has never been of more critical importance than it is today. And these prosecutions once again show the Criminal Division and its partners efficiently and effectively striking at those who would abuse America's healthcare programs. Now, I'd like to take a moment to speak briefly about the types of alleged criminal scheme charged in this takedown. The largest amount of fraud charged in the cases announced today, representing more than $4.5 billion of alleged fraud, relates to telemedicine. That is, the use of telecommunications technology, like the phone or the internet, to provide healthcare services remotely rather than in person. That ability to provide healthcare remotely is a critical tool for those who might be homebound, in remote areas, or otherwise unable to visit their healthcare provider in person. And telemedicine has proven all the more critical during this national crisis, when so many Americans are isolating, quarantining, or otherwise restricting their face-to-face interactions. However, a number of the cases we are announcing today show that for all of its benefits, telemedicine, unfortunately, can also be exploited by criminal actors. For example, in a case charged in the District of New Jersey, a group of defendants allegedly submitted over $522 million of false and fraudulent bills for genetic testing to Medicare as part of a telemedicine scheme that involved patients in all 50 states, the District of Columbia, and the Virgin Islands. We are also announcing today charges brought in the Northern District of Illinois against a doctor who is alleged to have been the highest prescriber of genetic testing in the entire country, the largest such case to date, involving $145 million in alleged fraud losses. As I said earlier, telemedicine offers great promise to Americans, especially during this difficult time of national crisis. And we at the department remain committed to ensuring that this valuable tool, with all its promise, is not undermined by fraud and abuse. Another sizable amount of fraud that we are announcing today, nearly $850 million worth, relates to doctors and others who allegedly defrauded insurance providers and their own patients in connection with residential substance abuse treatment centers, or so-called sober homes. These are facilities that are supposed to provide life-saving care and treatment to some of the most vulnerable among us, those battling addiction. But unfortunately, there are those who would prey on these individuals, these vulnerable individuals, and illegally seek to exploit the system for their own financial benefit. For example, we have charged 10 defendants, including a CEO, 2 clinic owners, and 3 doctors, in connection with a $91 million fraud scheme involving inpatient and outpatient addiction treatment centers in Broward County, Florida. Now, this case comes on the heels of charging this summer, also in South Florida, the largest ever sober homes fraud case involving over $680 million in alleged loss. Now, these sober home cases are particularly egregious, not just because of the substantial amounts of financial fraud and loss that they involve, but also because of the significant harm that they can cause to patients who are used and abused along the way. In many of these cases, defendants are alleged to have preyed upon addicted patients, recruiting them from their hometowns, where they have support networks, and shipping them off to faraway states where they are placed into these so-called sober homes. Once there, these vulnerable individuals are often provided with drugs that undercut their ability to recover from addiction, and they are often shuffled from facility to boost headcount and maximize billing, instead of being given the addiction treatment care that they so desperately need. In some of our more troubling cases, and as alleged in the relevant charging documents announced in connection with the cases today, some patients also are referred out to other healthcare providers who bill for additional medically unnecessary tests, medications, and services. Other co-conspirators then provide kickbacks in return for access to these vulnerable patients. This fraud and abuse truly inflicts a human, not just a financial, toll on its victims. Now, we are also announcing cases today that are part of our ongoing efforts to combat the scourge of opioid abuse, charging doctors, lab owners, and others responsible for the illegal prescription and distribution of devastatingly addictive and dangerous opioid medications. In 2 of these cases alone, one charged in the Northern District of Alabama and the other in the Southern District of Ohio, the defendants, including, as I mentioned earlier, doctors and lab owners, are alleged to have been responsible for fraud schemes totaling over $40 million that involved prescription and distribution of more than 27 million doses of opioids. Now, these cases are only the latest efforts in the department's ongoing response to the nation's opioid epidemic, and they follow the Criminal Division's 2018 creation, with our U.S. Attorney's Office and law enforcement partners, of the Appalachian Regional Prescription Opioid Strike Force, or ARPO. The Department of Justice is committed to fighting the opioid epidemic that is plaguing America, and this takedown is just the latest example of our work in this very important area. Now, these are just several examples of the types of cases that we are announcing today as part of our national healthcare fraud and opioid takedown. It is, of course, important to remember that the charges I've referred to here today are merely allegations against the defendants. The defendants remain presumed innocent until they are found guilty beyond a reasonable doubt. But I do highlight these cases to demonstrate the diversity and variety of the schemes at which we are taking aim, and to emphasize the department's comprehensive approach to bringing accountability to those who would steal taxpayer dollars for personal gain. Now, before I turn the podium over to our law enforcement partners, let me take a moment to mention a few points about this comprehensive approach. First, I want to note the unparalleled interagency cooperation led by our fraud section's healthcare fraud unit, but dependent on our partners, that makes today's announcement possible. The cases we are announcing today are a reflection of the strong partnerships we have developed with our law enforcement partners, our colleagues in U.S. attorneys' offices around the country, and other federal agencies. Let me give you one concrete example of that partnership. In addition to the cases we are announcing today, the Centers for Medicaid and Medicare Services Center for Program Integrity has imposed more than 250 billing privilege revocations to further ensure the integrity of our federal healthcare programs. These revocations immediately prevent further wrongful dissipation of taxpayer-funded healthcare resources, and the size, scope, and speed of our CMS CPI partners' action on these revocations is an enormously important tool in our efforts to combat healthcare fraud. I want to recognize and thank all of our partners, including those who are here with me today, for their efforts in today's cases and in combating fraud against the nation's healthcare programs. Now, the second point I want to highlight today about the cases we are announcing is the Criminal Division's agility in responding to existing as well as new and emerging threats. Two examples of this can be seen from the work in certain of the cases charged in today's takedown. First, just this year, the Criminal Division's fraud section created a new team called the National Rapid Response Strike Force. This team adds to and complements the fraud section's geographically targeted healthcare fraud unit prosecutors who are already operating in several strategic locations throughout the country. This new team's mandate is to address significant multi-district fraud schemes wherever they may occur, ensuring the federal resources can be deployed quickly, at a moment's notice, to respond to new and emerging threats to our nation's healthcare system. And some of the cases announced today are the direct result of the work of this new team of prosecutors. Now, a second example is our continuing use of data analytics. You've heard me talk many times about the Criminal Division's pioneering use of data to strategically target wrongdoing in a number of different areas. Many of these prosecutions that we are announcing today are the direct result of our use of data analytics. The fraud section, in close partnership with our friends at the FBI, the HHS OIG, and the DEA, routinely apply cutting-edge data analysis to quickly identify, investigate, and prosecute healthcare fraud and the illegal prescription and distribution of opioid medications. This data-driven approach will continue to be a vital tool utilized by federal law enforcement to identify, investigate, and prosecute criminal activity in the healthcare space. Now, the last point I'll make today goes to the significance of being able to announce a law enforcement operation of this size and this magnitude at this time. The challenges our country has faced and continues to face as a result of the COVID-19 pandemic are many, and our prosecutors and law enforcement partners are by no means exempt or immune from them. On a professional level, these challenges have included court closures, travel restrictions, and limits on the sort of in-person and face-to-face interaction through which so much of our law enforcement activity is done. But I am proud to say that, as today's results clearly demonstrate, these challenges have not stopped us or even slowed us down one bit. As I have said many times, the Criminal Division of the Department of Justice remains open for business. We have not allowed the challenges presented by the ongoing pandemic to prevent us from doing our job for the American people. In fact, each of the cases that we're announcing here today has been brought in the months since the President declared a national health emergency earlier this year in connection with the ongoing pandemic. Despite all of the personal and professional challenges that every one of the prosecutors, agents, and staff have faced during these extraordinary times, we have not wavered in our commitment to protecting the American people from fraud, and we will continue to remain vigilant in this space and in others, no matter what challenges we may face in the future. So my thanks for today's announcement go to all those here in the department, in particular those in the healthcare fraud unit within the fraud section, our partnering U.S. attorneys' offices, and law enforcement personnel from the FBI, HHS OIG, and the DEA, all of whom, working together in close partnership and collaboration, have made this announcement possible. But I'll pause to say that we have much more to do. Going forward, we will continue to identify, investigate, and prosecute healthcare fraud schemes that seek to steal taxpayer funds, and which far too often come at the expense of patients' care and well-being. Thank you all for joining us here today. Thank you for being a part of this historic announcement. And with that, I'd like to turn it over to Assistant FBI Director Calvin Shivers to say a few words about the FBI's important work in this area. Thank you.
Good morning. Addressing healthcare fraud is a priority for the FBI. I am proud to stand here today with my DOJ colleagues and our law enforcement partners to discuss the fruits of our collective efforts in addressing this threat. Together with our federal, state, and local partners, as well as regulatory agencies, many of whom are represented here today, we seek to investigate and prosecute the most egregious offenders committing healthcare fraud. Through strong partnerships with HHS OIG, HHS Centers for Medicare and Medicaid Services, the Food and Drug Administration, the Drug Enforcement Administration, Defense Criminal Investigative Services, OPM, OIG, IRS Criminal Investigative, and state Medicaid fraud control units, we're able to hold those who commit healthcare fraud accountable for their actions. Rooting out healthcare fraud is central to the well-being of every American citizen and the overall U.S. economy. Healthcare fraud schemes continually evolve and target both public and private health insurance plans. Healthcare fraud costs the U.S. tens of billions of dollars every year. Beneficiaries and other recipients of healthcare fraud bear the brunt of the damage caused by healthcare fraud through higher premiums, increased taxes, and reduced services. What we find most disturbing in addressing healthcare fraud is the fact that the same medical professionals who are entrusted with providing medical care are placing personal gain above patient well-being and safety. Today's announcement is focused on over 300 fraudsters who placed personal gain before patients. This includes physicians, medical professionals, and co-conspirators who profited from COVID-19 related fraud schemes at the expense of the American taxpayer, those who exploited the public's increased reliance on telemedicine for critical medical care, those who billed billions to health insurance programs and private plans for unnecessary medical procedures and/or treatments that were never provided, and those who exploited patients in desperate need of addiction recovery treatment. In many cases, these patients' vulnerabilities plunged them further into the throes of addiction. These cases and prosecutions disrupted what were in many instances multi-million-dollar criminal enterprises. These cases highlight the success of the collaborative approach fostered by DOJ's healthcare fraud strike forces. The FBI, together with our federal, state, and local partners, remain steadfast in our commitment to identify and root out healthcare fraud, no matter what form it takes. We will continue to work tirelessly to ensure public and private healthcare dollars are used as intended, and that is to promote the health and safety of all Americans and ensure continued access to critical healthcare services. Thank you. And I will now turn it over to Gary Cantrell, who is Deputy Inspector General of Investigations for HHS OIG.
Thank you, Calvin. Today's announcement is the result of the outstanding investigative efforts of nearly 175 HHS OIG agents and analysts working tirelessly across the nation with our partners to identify and disrupt this surge of fraud schemes. These schemes preyed on federal health care program beneficiaries and illegally diverted funds from these vital programs. Thank you to the men and women of my agency, the Medicare Fraud Strike Force teams, our law enforcement partners, and the countless other professionals in both public and private health plans who continue to fight healthcare fraud, especially during the ongoing pandemic. I applaud your unwavering support of our shared mission. Digital and health technology, including telemedicine, can be beneficial in fostering efficient, high-quality care when practiced appropriately and lawfully. Unfortunately, bad actors attempt to abuse telemedicine services to mislead beneficiaries about their health care needs and bill the government for illegitimate and wasteful services. Since 2016, HHS OIG has seen significant increases in what we call telefraud, scams that leverage aggressive marketing and so-called telehealth services to commit fraud. In response, we initiated a multi-pronged approach to identify and dismantle these fraud schemes and prevent future losses to federal health care programs. We worked closely with our partners at the Centers for Medicare and Medicaid Services Center for Program Integrity, identifying emerging trends and suspicious providers so that HHS OIG and CMS could monitor how criminals were attempting to take advantage of Medicare. This ongoing communication and collaboration allowed CMS to take the largest administrative action in history to avoid paying suspicious claims and to revoke the billing privileges of providers involved in these schemes. Additionally, we used data analytics, tips from our OIG hotline, and boots-on-the-ground intelligence to root out fraud committed by errant medical providers in a timely and innovative fashion. These Medicare and Medicaid patients were preyed on by way of unsolicited phone calls, television commercials, internet pop-up advertisements, and other means. Also, these providers and prescribers could profit. In many cases, beneficiaries were led to believe that diagnostic or genetic testing, prescription medications, or medical equipment were required to improve their health conditions. However, those services were either never rendered or, when provided, potentially delayed beneficiaries' pursuit of appropriate treatment and medical care. Instead of receiving quality care, these beneficiaries were victimized. Their health outcomes, as well as the federal health care programs they depend on, were directly threatened. Unfortunately, audacious schemes such as these are prevalent and often harmful. Therefore, collaboration with our partners remains critical in our fight against healthcare fraud. In close coordination with our law enforcement partners, OIG will continue to protect the integrity of essential federal healthcare programs and the millions of individuals who rely on these programs. Thank you, and now I'm going to turn it over to Tim Mcdermott, Assistant Administrator with the DEA.
Good morning. I'd first like to thank our partners who led this effort. The Drug Enforcement Administration is proud to partner with each of you. For more than a decade, our nation has been plagued by the devastation of the opioid crisis, which we know was largely created by overprescribing of opioid medication and now is being driven by illicit fentanyl. Due to the efforts of DEA and our partners, from January 2017 through August of 2020, we have seen the number of opioid prescriptions drop nearly 37%, a reduction in over 47% of opioids dispensed, and most importantly, an 18% drop in prescription overdose deaths in the last 2 years. Additionally, since 2016, DEA has reduced the amount of opioids manufacturers produce by a proposed 60%, while continuing to ensure there are adequate supplies in hospitals nationwide to support patients suffering from COVID-19. There is still much more work to be done. 2019 preliminary data suggests nearly 70% of overdose deaths in the United States were opioid-related. DEA understands the pivotal role we play in addressing the ongoing crisis, and we use every tool at our disposal, administrative, civil, and criminal, to ensure the agency's 1.9 million registrants who handle prescription drugs comply with the law, while safeguarding patient access to legitimate and necessary prescription medications. We know that if we prevent diversion of prescription medication, we can reduce the number of people who become introduced to them. In addition to supporting the role of the healthcare fraud component of this takedown, DEA's nationwide regional efforts comprised of multiple investigations across the United States, resulting in more than 32 cases, 32 search warrants, and 61 arrests. Targets of these investigations include medical practitioners, pharmacies, and other individuals who we believe were contributing to these sinister schemes. It's important to emphasize that our actions target unethical practitioners operating recklessly and putting patients at risk for their own personal gain. The diversion of prescription opioids by a small number of practitioners, less than a fraction of 1%, have disproportionately impacted this epidemic. DEA is dedicated to working with the vast majority of healthcare professionals that strive to provide the highest standards of care to patients. The brave men and women of DEA remain committed to doing everything we can to address this threat. We stand with our partners steadfast in protecting the health and safety of our communities, and we will continue to do our part to stop prescription drug diversion, prevent misuse, and end this devastating opioid crisis. Thank you.
Thank you again to each of our law enforcement partners and our U.S. Attorney's Office partners around the country who have made today's truly historic announcement possible. I believe we have some time for a handful of questions if there's anybody on the line. I do want to say at the outset that we have a background briefing scheduled after this press conference today. And so if I'm not able to answer your questions, or if one of my partners is not able to answer your questions, we may refer you to that briefing for further information. So with that, I'll turn it over to Matt.
We'll now begin the question and answer session. To ask a question, you may press star then one on your touch-tone phone. If you're using a speakerphone, please pick up your handset before pressing the keys. To withdraw your question, please press star then two. At this time, we'll pause momentarily to assemble the roster. Again, if you have a question, please press star then one. This time we have no questions. I'll turn the call back over to the conference leaders.
Good. Well, if we have no questions, then we will conclude today's press conference. Again, I'd like to thank everybody who's joined us here today. I'd like to thank our law enforcement partners on the stage with me, and I'd like to thank all of the Criminal Division and Department of Justice attorneys who have made these cases possible. As I mentioned, there will be a background briefing immediately following this press conference, and so if there are additional questions that you may have, please stay on the line to participate in that. It will begin immediately.